Bismillahirrahmanirrahim. Quote for today is you have to keep breaking your heart until it opens. Today, the topic of my presentation is lead poisoning and occupational cancer, and I'm presenting it under the supervision of my professor, Dr. Saira Afzal. Learning outlines of the presentation are introduction of lead poisoning, types of lead poisoning, source of exposure, effects on organ systems, prevention and treatment, occupational cancers, and their prevention. At the end of this presentation, participants will be able to describe about occupational cancers, lead poisoning, its causes, effects on human body, along with its prevention and treatment. Now, introduction of lead poisoning. Lead poisoning, also known as plumbism or citronism, is a type of metal poisoning that is caused by lead in the body. Lead poisoning or lead intoxication has been defined as exposure to high levels of lead, typically associated with severe health effects. Exposure to lead can occur by contaminated air, water, dust, food, or consumer products. Children are at the greater risk as they are more likely to put objects in their mouths, such as those that contain lead paint, and absorb a greater proportion of the lead that they eat. The brain is the most sensitive for lead poisoning. Poisoning is a pattern of symptoms that occur with toxic effects from mid to high levels of exposure. Toxicity is a wider spectrum of effects, including subclinical ones, those that do not cause symptoms. The amount of lead in the blood and tissues, as well as the time course of determines toxicity. Lead poisoning may be acute or chronic, from intense exposure of short duration or to repeated low-level exposure over a prolonged period. Now, the history says that in 2016, lead is believed to have resulted in about 540,000 deaths worldwide. It occurs most commonly in the developing countries. There also are numerous cases in the developed world, with there being thousands of American communities with higher lead burdens than seen during the peak of the Flint water crisis. Those who are poor are at greater risk. Lead is believed to result in 0.6% of the world's disease burden. People have been mining and using lead for thousands of years, and description of lead poisoning date to at least 2000 before Christ, while efforts to limit lead use dates back to at least 16th century. Concerns for the low level of exposure begins in the 1970s, with there being no safe threshold for lead exposure. Poisonous levels of lead. Current standards define a lead blood level of 10 microgram per deciliter in the as being toxic in the children, and in adults a level of 25 microgram per deciliter is considered toxic. Any level of lead that can have toxic manifestations, and all healthcare practitioners should become familiar with the signs, symptoms, and treatment of lead poisoning. According to classification, it can be acute, that is intense exposure, or chronic from repeated low-level exposure over a prolonged period. Acute lead poisoning. In acute lead poisoning, typical neurological signs are pain, muscle weakness, numbness, tingling, and rarely symptoms associated with the inflammation of brain. Abdominal pain, nausea, vomiting, diarrhea, constipation are other acute symptoms. Lead's effect on the mouth include astringency and metallic taste. GI problems such as constipation, diarrhea, poor appetite, weight loss are common in acute poisoning, and absorption of large amount of lead over a short time can cause shock due to loss of water from the gastrointestinal tract. Hemolysis. The rupture of red blood cells due to acute poisoning can cause anemia and hemoglobin in the urine. Damage to kidneys can cause changes in the urination, such as acquired Fanconi syndrome and decreased urine output. People who survive acute poisoning often go on to display symptoms of chronic poisoning. Chronic lead poisoning is associated with the three main types of symptoms: gastrointestinal, neuromuscular, and neurological. Signs of chronic exposure includes loss of short-term memory or concentration, depression, nausea, abdominal pain, loss of coordination, and numbness and tingling in the extremities. Hallucination is not a feature of lead poisoning. Fatigue, problems with the sleep, headache, stupor, slurred speech, anemia are also the features of chronic lead poisoning. A lead hue of the skin with pallor or lividity is another feature. A blue line among the gum with bluish black edging to the teeth, known as Burton's line, is another indication of the chronic lead poisoning. Children with chronic poisoning may refuse to play or may have hyperkinetic or aggressive behavior disorder. Visual disturbances may present with gradually progressing blurred vision as a result of central scotoma that is caused by toxic optic neuritis. CNS and neuromuscular symptoms usually result from intense exposure, while GI symptoms usually result from exposure over longer periods. Now, effects in children. Younger children are much more vulnerable to lead poisoning as they absorb 4 to 5 times more lead than an adult from given source. The classic signs and symptoms are loss of appetite, abdominal pain, vomiting, weight loss, constipation, anemia, kidney failure, irritability, lethargy, and behavioral problems. Slow development of normal childhood behavior such as talking and use of words and permanent intellectual disability are both commonly seen. Although less common, it is possible for fingernails to develop leukonychia if exposed to abnormally high lead concentration. Effects of lead poisoning on reproduction. Lead affects both male and female reproductive systems. In men, when blood glucose levels exceeds 40 microgram per deciliter, sperm count is reduced, and changes occur in the volume of sperm motility and their morphology. And a pregnant woman's elevated blood lead level can lead to miscarriage, prematurity, low birth weight, and problems with the development during childhood. Effects on fetus. Lead is able to pass through placenta and into breast milk, and blood levels in the mother and infants are usually similar. A fetus may be poisoned in utero if lead from the mother's bones is subsequently mobilized by the changes in metabolism due to pregnancy. Increased calcium intake in pregnancy may help mitigate this phenomenon. Sources of lead. Lead is common environmental pollutant. Causes of environmental contamination includes industrial use of lead, such as found in facilities that process lead acid batteries or produce lead wires or pipes, or metal recycling and foundry. Storage batteries and ammunitions are made with the largest amount of lead consumed in the economy each year. Children living near facilities that process lead, such as lead smelters, have been found to have unusually high blood lead levels. Occupational exposure. In adults, occupational exposure is the main cause of lead poisoning. People can be exposed when working in facilities that produce a variety of lead contaminating products. These includes radiation shields, ammunition, certain surgical equipments, digital X-rays. Each film packet has a lead thinner to prevent the radiation from going through. Fetal monitors, plumbing, circuit boards, jet engines, and ceramic glazes. Food as a source of lead. Lead may be found in the food when food is grown in the soil that is high in lead. For example, in Bangladesh, lead compounds have been added to turmeric to make it more yellow. In May 2015, Indian food safety regulators in the state of Uttar Pradesh found samples of Maggi 2 minutes noodles contained lead up to 17 times beyond permissible limits. Lead in paints. Some lead compounds are colorful and are used widely in paints. Deteriorating lead paints and lead containing household dust are the main cause of chronic lead poisoning. The lead breaks down into the dust, and since children are more prone to crawling on the floor, it's easily ingested. In oil painting, it was once common for colors such as yellow or white to be made with the lead carbonate. Soil as lead source. Residual lead in the soil contributes to lead exposure in urban areas. Lead content in soil may be caused by broken down lead paint, residues from lead containing gasoline, used engine oil, tire weights, pesticides used in the past, contaminated landfills, or from nearby industries such as foundries or smelters. Lead from the atmosphere or soil can end up in the groundwater and surface water. Water as lead source. It is also potentially in drinking water, for example, plumbing and fixtures that are either made of lead or have lead soldiers. Since acidic water breaks down lead in plumbing more readily, chemicals can be added to municipal water to increase the pH and thus reduce the corrosivity of the public water supply. Now, the prevention of lead poisoning. In most cases, lead poisoning is preventable by avoiding exposure to lead. Prevention strategies can be divided into individual, preventive medicines, and public health. By individual, recommended steps are increasing the frequency of hand washing and increased intake of calcium and iron. Second is to discouraging them from putting their hands into the mouth and vacuuming frequently and eliminating the presence of lead contaminated objects such as blinds and jewelry in the house. In the house with lead pipes or plumbing solders, these can be replaced. Less permanent but cheaper methods include running water in the morning to flush out the most contaminated water or adjusting the water's chemistry to prevent corrosion of pipes. Secondary prevention includes blood level testing and follow-up care and referral. It remains an essential safety net for children who may already be exposed to lead. A blood test is the easiest way to determine if the child has been exposed to lead or not. The amount of lead in the blood is referred to as the blood lead level, which is measured in the micrograms of the lead per deciliter of blood. Treatment is chelation therapy. Treatment of iron, calcium, zinc deficiencies, which are associated with increased lead absorption, is another part of the treatment for chronic lead poisoning. Chelation therapy is used in cases of acute lead poisoning. When lead contaminated materials are present in the GI tract, it leads to whole bowel irrigation should be done, cathartics and endoscopy should be done, or even surgical removal may be used to eliminate it from the gut and prevent further exposure. The chelating agent used for the treatment of lead poisoning are aditate disodium calcium and dimercaprol, which are injected, and the succimer and dipencilamine, which are administered orally. Now, occupational cancers. Occupational exposures to chemical dust, radiation, and certain industrial processes has been tied to occupational cancers. Exposure to cancer-causing chemicals may cause mutations that allow cells to grow out of cells causing cancer. Thousands of people die each year from cancer, and asbestos-related diseases account only for 100,000 deaths worldwide per year. This slide shows epidemiology, and an estimated 48,000 cancers are diagnosed early in the US that comes from occupational cancer, and this represents 4 to 10% of the total cancers in the United States. Lung cancer, mesothelioma, bladder cancers are the most common type of occupational cancers. Occupational cancers concentrate among specific groups of working population. Now, biological carcinogens, there are these are the types of occupational carcinogens, biological, chemical. The chemicals may occur naturally, such as asbestos or manufacturers like vinyl chloride, and there can be physical carcinogens, and physical carcinogens may include ionizing radiations, such as X-rays, alpha, beta, gamma radiations. UV radiations can be divided into a number of bands, such as UVB, UVC, etc. In June of 2019, a working group convened by the International Agency of Research concluded that night shift work is probably carcinogenic to humans. And most commonly, it is related to breast cancer. Now, bladder cancer, there are three main causes: urothelial carcinoma, squamous cell carcinoma, and adenocarcinoma. Main causes among the occupation are rubber, leather, paving, roofing, printing, textile industries, dyeing products, chimney sweeping, and mechanists may have hairdressers, barbers, and truck drivers. They all can have this phase. In the kidneys, painting, metalworking, petroleum, plastics, and textile industries these are the occupations that can lead to kidney cancers. For larynx, metalworking, petroleum, rubber, plastic, textile, laryngeal cancer is the disease in which malignant cancer cells form in the tissue of larynx. Liver, lung, all these occupational asthma has a poor prognosis when the employee remains in the sensitizing environment, and symptoms can be triggered by even low amount of sensitizer. Leukemia is a type of cancer that affects the blood cells and bone marrow. People with leukemia sometimes experience remission, a state after diagnosis and treatment in which cancer is no longer detected in the body. Mesothelioma. Mesothelioma is a malignant tumor that is caused by inhaled asbestos fibers and forms in the lining of the lungs, abdomen, or heart. Symptoms can include shortness of breath and chest pain. The life expectancy of mesothelioma patient is approximately 12 months after diagnosis. Skin cancer is the abnormal growth of skin cells most often develops on the skin that is exposed to sun. There are three major types of skin cancer: basal cells carcinoma, squamous cell carcinoma, and melanoma. Now, prevention of occupational cancers. Many occupational cancers are preventable. Personal protective gears, workplace controls, worker education prevent exposure to carcinogens in the workplace. Tobacco smoking has also been shown to increase the risk of work-related cancers. International Labour Organization has also adopted occupational cancers. Agencies in the US Food and Drug Administration, Environmental Protection Agency, the International Agency for Research on Cancers and Occupational Safety and Health Administration have developed safety standards and limits for chemical and radiation exposure. Now, coming towards the recent advances, an article published is Occupational and Cancer Incidence in District Dir, NWFP, Pakistan. This shows that data regarding occupational cancers were collected from Cancer Registry of Institute of Radiotherapy and Nuclear Medicine. And medical records of 11,005 patients were traced in life, and it was observed that 61% were males and 39 were females. Cancer in the laborers and other people like government employees, businessmen, and shopkeepers were less than often. Another article shows external lead contamination of women's nails by soma in Pakistan is the biomarker reliable. Lead concentration in Pakistani pregnant women's nails were higher than expected. Lead containing surma consists of inhalable and bioavailable particles. Relationship between surma and nails were confirmed by lead isotope ratios analysis. Lead in the nail was derived from lead exposure and external contamination, and nail is not suited as a biomarker for the lead exposure in the countries that are using it. Another article shows the risk factor for the lung cancers in the Pakistani population. This shows strong association was observed for smoking. Pesticide exposure showed a confidence interval of 3.1 to 8.3, and exposure to diesel exhaust, red meat consumption, chicken consumption, and consuming vegetable, fruits, milk, juices can reduce the risk of lung cancer risk as in other countries. Now coming towards the MCQ session. First MCQ is a patient who is plumber by profession presented to OPD with the complaints of fatigue and yellowing of the skin for last 1 year. His CBC report shows no deficiency of hemoglobin. However, lead levels are found raised. The physician calls this as option A, sickle cell anemia, option B, lead hue, option C, Burton hue, and option D, Fanconi syndrome. Option B is the right one. This is the lead hue. Second MCQ is a person ABC working in asbestos company presented with a history of cough and sputum along with the weight loss. Patient also complains of pain, chest, on breathing. The diagnosed malignancy has life expectancy of about 1 year. The diagnosis is option A, adenocarcinoma lung, option B, squamous cell carcinoma, option C, carcinoid tumor, option D, malignant mesothelioma.
C.
Option D is the right one, malignant mesothelioma. As I've already told, the expectancy is about 1 year and patient is having difficulty in the breathing. Third MCQ is Mr. Imtiaz is a baker who just has been diagnosed with occupational asthma. Management want advice on how this disease will be managed. Which is the most appropriate management plan by occupational health for the management of this patient? Option A, salbutamol on symptoms. Option B, respiratory mask. Option C, health surveillance every month. And option D is deployment should be done.
B.
B.
Option D is the right one in this scenario because respiratory mask because it's not that much practical for this scenario. Fourth MCQ is a person XYZ lives in an industrial area where lead is being processed. He has 3 children. His 6 years old girl is developing slurred speech for few months, and mother also notices a bluish black line around her gums and teeth. Physician calls this as option A lead hue, option B Burton's line, option C scurvy, and option D gingivitis.
B.
Yes, option B is the right one. Burton's line is the right one also. Fifth MCQ is ionizing radiations include X-rays, gamma radiations. Ultraviolet radiations are also ionizing radiations, some of which are known to cause skin cancer. Keeping in view the type of carcinogens, these antigens are of the following types. Option A, biological antigens. Option B, chemical antigens. Option C, physical antigens. And option D, natural antigens.
B.
C.
Yes, option C is the right one. Physical antigens. These carcinogens comes under the category of physical antigens. Sixth MCQ is a working group convened by the International Agency for Research on Cancers concluded that night shift work is probably carcinogenic to humans. Shift work is most of the time thought to be associated with which pathology? Option A, breast cancer, option B, renal carcinoma, option C, leukemia, and option D, testicular cancer.
C.
C.
Option A is the right one. Breast cancer is most commonly associated with this carcinogen. Seventh MCQ is storage batteries and ammunitions are made with the largest amount of lead consumed in the economy each year. All of the following are possible sources of lead exposure except option A, dust in the older buildings, option B, soil near freeways, option C, paint chips in the facilities built before 1978, and option D is water in the newly constructed PVC pipes. Option D is the right one because I have used the word newly constructed pipes. In lead pipes that are old, lead is the main source. However, new pipes, it is not the main. Eighth MCQ is a person ABC presented to emergency department with the shortness of breath along with a severe pallor and decreased urine output for last 2 days. He works as X-ray technician and is working continuously for the past 3 days. To treat acute lead poisoning, chelation is given as option A, injectable penicillamine, option B, injectable dimercaprol, option C, oral dimercaprol, and option is desferoxamine. Option B is the right one. Injectable dimercaprol is given. Penicillamine should be given orally. 9 MCQ is poisoning is a pattern of symptoms that occur with all the toxic effects from mid to high levels of exposure. All of the following are seen in the lead poisoning. Option A, hallucination. Option B, GIT disturbances. Option C, peripheral neuritis. And option D, encephalitis.
D.
Option A is the right one. Hallucinations are the features that are not seen in the lead poisoning. However, all these following can be seen. 10th MCQ is some lead compounds are colorful and are used widely in the paints. The lead paint is a major route of lead exposure in children. The children licks wall paints and eat some off from floor. The taste of lead is mostly felt as option A sweet, option B astringent, option C umami, and option D bitter.
B.
D.
Option B is the right one. Metallic taste is astringent. This is the key of MCQs along with the slide numbers from where they are taken. This is the YouTube link of our channel, and thank you.
Thank you very much, Dr. Isma. Very nice presentation and very